Hello everyone, welcome back to the channel. Last time we learned about the stabilization and poisoning cases, how to keep a patient safe in those first critical movements. Today we are moving forward and will talk about the general management of poisoning, that is supportive care, evaluation and monitoring parameters. These are the steps that keep the patients alive and stable even before we know what exactly the poison was taken and which poison was taken. And of course, by the end of the session, you will understand how to systematically approach any kind of poisoning cases, manage any complications like seizures, temperature changes, or any kind of electrolyte problems, and give the right supportive care to save the lives. Let's start with the chapter. So imagine a patient comes to the hospital after ingesting any kind of poison. But you see that the patient is very alert, talking normally, and the pulse is also stable. They are not in any kind of immediate danger. And in such cases, what it's important to do is that step by step examination. What do we call those step by step examination is systematic clinical examination to see how the poison is affecting their body. So it is a management of physiological disturbances caused by toxins independent of antidotes. So what this means that it means that this what we do is called supportive care. It means we treat the problems caused by the poison in the body. What does supportive care means? We treat the problems caused by the poison. And what we do, like abnormal heart rhythms, seizures, low or high electrolytes, or lower body temperature changes, even if there is no specific antidote present. Why is it important? These are the following 4 points why it's very important to do the first supportive care. First, most poisons do not have antidotes. Less than 10% of poisons have their antidote. Supportive care prevents life-threatening complication like abnormal heart rhythm, what we know as arrhythmias, seizures, electrolyte acid-base disorders. Third, it reduces sickness or death even before we know what exactly the poison was taken and which poison was taken. And lastly, it buys time for the body to detoxify naturally or until a specific treatment is available. What is the key point? What here we understand that supportive care saves more lives than antidotes. What we have to prioritize here, that we have to always prioritize stabilizing the patient first. Stabilizing the patient first. Right. Once the patient is stable, one of the first thing what we do is to check the body temperature because poison can make it too high or too low. Let's see how do we handle this. And any kind of hypothermia state or hyperthermia state, both can be dangerous. There can be two cases in temperature, body temperature. Hypothermia, that is low body temperature, and hyperthermia is high body temperature. Let's understand what happens in hypothermia. How do we check that? We use a low reading thermometer, rectal or esophageal. Why do we use this kind of thermometer? Because normal thermometers may not give any kind of accurate results. Next is how do we treat those patients? We have to treat any kind of first. How do we treat is warm blankets, warm IV fluids, and heated air. And if there is any kind of associated issues like low blood pressure, that is hypoventilation, we have to treat it first. Then comes is hypoventilation. Hypoventilation is slow breathing. And acidosis, any kind of acid base problems, and hypokalemia is low potassium levels. Right. These are the kind we have to once we treat the patient, then we have to treat the any kind of associated issues that comes with the hypothermia cases. So what we understand that we do not have to rush for things. We have to do first is gradual warming if the patient has low body temperature. Next comes is hyperthermia, that is high body temperature. How do we treat those? Remove any kind of extra clothing. We have to use ice packs in where neck, groin areas or armpit. Third, we have to use cool temperature, cool water immersion, but we have to stop the cooling once the temperature reaches 102 degree Fahrenheit. For malignant hypothermia, hypothermia is a very rare condition, a rare dangerous reaction that comes from anesthesia. Malignant hypothermia is rare dangerous reaction that comes with anesthesia. And for that, what we use is dantrolene. For that, what we use is dantrolene. Next is very important that paracetamol does not help in any kind of hypothermia that is caused by poisoning. So hypothermia tells us we have to cool carefully the patients, right? Once the temperature is under control, the next important step is to check for the electrolyte acid base problem, because poison can lead to any kind of serious complications associated with those electrolyte and acid base problem. So in acid base disorders, what we understand that we check that blood, whether the blood is very acidic or very basic, and which can be dangerous. How do we check those acid base disorders? We check it via arterial blood gas, ABG method, or serum electrolytes. ABG, arterial blood gas, helps us to check pH, partial carbon dioxide, and bicarbonate. Via pH, we can understand the overall acidity or alkalinity in the body. Partial carbon dioxide helps us to understand how well the lungs are removing carbon dioxide from the body. And bicarbonate tells us how well the kidneys are controlling the acid in your body. These are the arterial blood gas method. Second comes a serum electrolyte. This is used to calculate anion gap, which helps us to detect any kind of metabolic acidosis that is present in your body. So for that, in serum electrolyte, what we calculate is the anion gap. Here's a formula for the anion gap. And normal anion gap should be 12 to 16 millimole per liter. If there is greater than 20 millimole per liter, then we can understand that metabolic acidosis is present in your body even if the pH looks normal. So ABG tells us the overall acid base status, and anion gap tells us if there is any kind of metabolic acidosis caused by the problem. What high anion gap? That is greater than 20. High anion gap, something is very acidic or building up in your body. Once we know this, that the acid base balance, we also need to check the electrolytes like potassium, sodium, calcium, because poison can disturb these two. Then what we have to check is for electrolytes, electrolyte levels. And what are those electrolyte levels? That is potassium, calcium, sodium, etc. Next comes is acid-base disorders. Acid-base disorder looks very scary, but if we follow any kind of step-by-step method, it's actually very simple to understand. So let's start. Think this chart as a decision tree making. So how do we check that? First, we have to take the arterial blood sample, right? In arterial blood sample, what we do is first check the pH. After taking the arterial blood sample, what we do is check for the pH. If pH is less than 7.4, we can understand that it's a acidosis. Acidosis means the blood is too acidic. And if the pH is more than 7.4, it is alkalosis. Alkalosis, blood is too basic. So the first question is always, is the blood always acidic or basic? Is the blood acidic or basic? Second, what we have to do is we have to find the cause. Find the causes, we check about the bicarbonate and carbon dioxide to see if the problem is metabolic or respiratory. In acidosis condition, if the bicarbonate is low, that is less than 24, it's a metabolic acidosis. And if the partial carbon dioxide is high, that is more than 40, then it's a respiratory acidosis. In alkalosis, if carbon dioxide is high, that is more than 24, it's a metabolic acidosis. And if carbon dioxide is low, that is less than 40, it's a respiratory alkalosis. So the second question what we see is that a metabolic problem or a respiratory problem? Is metabolic problem or respiratory problem? So once this is clear, we have to understand any kind of compensation. Like the body always try to compensate something. So if the main problem is metabolic, the lungs will help by changing the carbon dioxide level. And if the main problem is respiratory, the kidneys will try to help changing the bicarbonate levels. Like how do we understand? If there's a metabolic problem. If there's a metabolic problem, respiratory compensation will take place. And if there's a respiratory problem, then renal compensation will take place. So what do we understand that pH tells us acid versus the base. Bicarbonate helps us to understand whether it's a metabolic problem or respiratory problem. And lastly, what we see that compensation comes from the opposite system. Like pH decides the direction, bicarbonate and carbon dioxide tells us the cause, and the opposite system tries to fix it. So once you remember this flow, pH first, then bicarbonate versus carbon dioxide, then we have to check for compensation, and then you will never get confused with the acid base disorders again. Right. Now let us talk about the acid base disorders. This happens when our body's pH balance gets disturbed, either becoming too acidic or too alkaline. In poisoning cases, this is very common. And let's see the main types, their cause, and how do we use or manage them. So first is respiratory alkalosis. What happens is here too much breathing takes place, too much carbon dioxide is low, and here blood also becomes alkaline. What causes this? It causes anxiety, hypoxia, pregnancy, sepsis, salicylates, and catecholamines. How do we manage that? We have to treat the root cause. If oxygen is low, we have to give the oxygen therapy. Second comes is respiratory acidosis. What happens here is breathing is suppressed, carbon dioxide accumulates, blood becomes very acidic. And what is the cause? Cause due to any kind of opiates, sedatives, airway obstruction, pneumonia, pulmonary edema, etc. How do we manage them? We have to manage them providing airway support or ventilation with the help of ventilation. Third comes is respiratory acidosis. It's a chronic with compensation. What happens here is we have to, in chronic lung disease, carbon dioxide stays high for a long time in your body, but the body keeps adjusting. It is caused by COPD, chronic neuromuscular disease, or chronic CNS depression. How do we manage them? Long term respiratory support, plus we have to treat the underlying problem. Fourth is metabolic alkalosis, that is high urine chloride. It caused by due to the Cushing, cons, steroid use, diuretic or alkali overdose. We have to manage it via stop any kind of offending drug, correct the fluids, give potassium or treat any kind of hormone problems. Fifth is metabolic alkalosis, low urine chloride. It is caused by vomiting, post diuretic stage or post hypercalcemia. We manage it via replace any kind of fluids or electrolytes, especially chloride or potassium. Next come is metabolic acidosis. Acidosis without any acid building up. It is caused by a diarrhea, renal tubular acidosis, CA inhibitor, aldosterone problems, hyperkalemia, hypercalcemia. And management is we have to correct the underlying cause, fluids and electrolytes. Next is metabolic acidosis, that is mud piles. We remember this is MUDPILS as a trick. It is caused by M stands for methanol, uremia, DKA, paraaldehyde, phenformin, iron isoniazide, salicylates, and starvation. How do we manage them? We manage it with sodium bicarbonate, especially in salicylate, TCA, methanol, ethylene glycol poisoning, and in severe cases, dialysis is required. So what we understand that we always have to check the acid base disorder, we have to find the cause and then we have to correct it. And supportive management often saves the life before any antidote is given to the patients. Right. Next comes is sodium bicarbonate therapy. This is one of the most important supportive treatments in poisoning. Think of it as a medicine that makes the body and urine more alkaline, that is less acidic. Why do we do that? Because many poisons are more harmful in acidic conditions, and alkalinizing it, we can either increase their removal or reduce their toxic effects. And when do we use that? We use in this method. Salicylate poisoning, it alkalizes urine and increases excretion in the patient. In TCA overdose, it reverses sodium channel blockage and corrects any kind of acidosis. In methanol or ethylene glycol, buffers any kind of severe metabolic acidosis. In barbiturates or any kind of others poisoning, general supportive alkalizing is seen. In myoglobinuria, prevents any kind of renal injury to the patient. Iron poisoning indication, we see that it neutralizes any kind of acidity. So, what precautions we have to take at? We have to precautions that we have to use. We have to avoid in hypokalemia state. Any overuse can cause metabolic alkalosis, that is too much alkalinity in your body. And third precaution what we have to take is we have to always monitor the pH and electrolytes while giving it. So what are these are the doses range. Doses range is 2 to 3 ampules, that is 8.4% in 1 liter of 5% dextrose via IV route over 3 to 4 hours. Maintenance doses 100 to 150 milliequiliter in 1 liter at 150 to 200 ml per hour. So what we have to target, that is the main goal, is we have to maintain pH more than or equal to 7.5, preferable is 8. So sodium bicarbonate is not just a simple antacid, it's a life-saving antidote. This is a life-saving antidote. Next comes is neurological complication. So when a poison affects brain and nerves, different problems can occur, and let's break them step by step and help us to understand. So if there's the first neurological complication that comes is convulsion. We often see it with isoniazid, theophylline, TCA. This is a kind of antidepressant, cocaine, organophosphate poisoning. What are the treatment? We have to provide the first oxygen, right? We have to keep the airway clear. Second, we have to give benzodiazepine. In benzodiazepine, lorazepam or diazepam is preferred. Next, if a seizure still persists, we see that the patient is still suffering from seizure, we have to then give phenytoin. And if still, even after giving phenytoin, the seizures is not controlled, then phenobarbital or any kind of anesthetic drugs we have to provide. Second complication what we see is of agitation, delirium, any restlessness condition, confusion state or very aggressive behavior. It is often seen with the anticholinergics like atropine overdose, even in amphetamine overdose, hallucinogens agents like LSD, etc. So the first treatment what we do is give diazepam. Diazepam helps in calming the patient, calms the patient. And in severe cases, we give haloperidol. These are for severe cases. Haloperidol, chloropromazine, right? And that also it's given with caution. Next comes is third is movement disorders. Any abnormal body movements. Abnormal body movements. Abnormal body movement, you can see this Parkinsonism. Here you can see that the body is very stiff. Body is in slow condition, tremor. This is usually called by phenothiazines or metoclopramide. Next we see is dystonia. You can see that it's a twisted portion, right? Sudden twisting or any abnormal portion. It is caused through because of antipsychotics, metoclopramide. Next is akathisia. This is feeling restless and can't sit still. The body keeps moving. This is caused due to SSRIs, MAOIs, and lithium. Next is chorea, jerky movement, dance-like movements. Right. Here it is caused due to phenytoin, amphetamines, levodopa. Next is tardive dyskinesia. This is slow, repetitive, chewing-like movements. You can see here lip smacking. This is caused due to after long term of having antipsychotics, chronic use of antipsychotics. Next comes is fasciculation. This is small twitching of muscles. This is caused due to the organophosphate poisoning, succinyl choline. And how do we treat these all movement disorders? We have to treat those by stopping the drug or poison that is causing this problem. And then we have to give any kind of supportive or symptomatic medicine depending on the type. Like for convulsion, we have to treat step by step, like giving oxygen, benzodiazepine, phenytoin, and then pentobarbital. Agitation, diazepam first, and then with the antipsychotics. And similarly, in movement disorders, what we have to do is we have to stop any kind of drug induced and improve after stopping the culprit of the drug. Right. Next comes is electrolyte abnormalities problem. When poison or drugs disturbs the body, they often mess up with the salts. So electrolyte basically is salts. It mess ups with the salts in our body like potassium level, sodium level and calcium level. These changes can be very dangerous because they can affect the heart, brain and muscles. So these are the condition. In hyperkalemia condition, the first scenario what we'll see is hyperkalemia, that is high potassium level. High potassium levels. It is caused due to digoxin, potassium sparing diuretics or succinyl choline. Why is it very dangerous? Because it can cause dangerous heart rhythm like arrhythmias. It causes arrhythmias. How do we treat it? We treat it giving insulin plus glucose. What insulin plus glucose does is it pushes the potassium back into this cells. Then what we can do is sodium bicarbonate. Sodium bicarbonate corrects the acidosis and shifts the potassium inside the cells. Next, giving the calcium gluconate. Calcium gluconate protects the heart from potassium toxic effect. Any kind of potassium's toxic effect. And we have to do dialysis in very severe cases. Next scenario is for hypokalemia, and that is low potassium level. It is caused due to beta 2 agonist, theophylline or diuretics. Why it is dangerous? Because it causes muscle weakness or irregular heartbeat. It causes muscle weakness and irregular heartbeat. It is a treatment is we have to give any kind of potassium supplement, oral or IV, depending on the severity case. Third case is hyponatremia, that is low sodium level. It is caused due to carbamazepine, SSRIs and oxytocin. What it causes? It causes brain swelling, which leads to confusion in the patient or in some cases seizures also. How do we treat that? If it's mild, we have to treat it with any kind of fluid restriction, and in severe cases we have to give hypertonic saline. And last scenario is hypocalcemia. That is hypocalcemia, low calcium levels. Low calcium levels in the blood. It is caused by ethylene glycol and hydrofluoric acid. What does it causes? It causes muscle spasm. It causes muscle spasm, seizures, or any kind of heart problems. How do we treat that? We treat it by giving slow IV calcium gluconate solution. Why do we give that? To safely restore any kind of calcium. So what we understand that in hyperkalemia we have to protect the heart and shift the potassium back into the cells. In low potassium level, we have to replace it with the potassium. Low sodium, we have to watch for any kind of brain swelling or and give hypertonic saline if it's a severe case. In low calcium level, we have to give calcium gluconate to the patient. Alright friends, that's it for today's session. We have covered some really important points about the general management of poisoning, and I hope the concepts are much clearer for you now. So what we have to ultimately remember that supportive care saves more lives than any of the antidotes. So these are the basics and the backbone of any kind of treatment. So if you found this session very helpful, don't forget to like, share and comment with your thoughts or any doubts. I'd love to hear from you. And of course, subscribe to the channel so you don't miss our next class. Stay curious, keep learning, and I will see you in the next session. Till then, take care and keep studying. Thank you.